You wake up, swing your legs over the side of the bed, and go to stand. That familiar grab hits you in your calves, knees, or hips. You hobble to the bathroom holding the wall and tell yourself it is just aging or arthritis. Here's what nobody tells you. Most leg pain after 60 is not from getting older. It is from what you do in the first 60 seconds after you open your eyes. That morning stiffness you feel for 5 minutes turns into a cane and then a walker. Today I will show you the exact sequence to do before you get up. Let's go. Part 1. The 3 mistakes that make leg pain worse. Before I show you what to do, I need to show you what you are probably doing wrong right now. If you keep making these 3 mistakes every morning, no exercise in the world will save your legs from years of unnecessary pain. Mistake 1. The stand and shake method. You wake up feeling stiff and tight all over your legs. So you throw your legs over the side of the bed immediately. You stand up fast and shake your foot like you are trying to wake it up. Stop doing this immediately because it is destroying your circulation. When you stand up instantly after lying down all night, gravity pulls 8 to 10 pounds of pooled blood straight down into your feet and ankles. Your leg veins have been relaxed and stretched out for 7 or 8 hours. They suddenly have to work against gravity with zero preparation or warning. Imagine starting your car on the coldest winter morning and immediately flooring the gas pedal. That is exactly what you are doing to your vascular system every single day. Here is what happens next after you stand up too fast. That sudden rush of blood stretches your delicate vein walls beyond their natural limit. Over time, those walls lose their elasticity completely. That leads to varicose veins, chronic venous insufficiency, and even dangerous blood clots. A study published in the Journal of Vascular Surgery found that people who stood up abruptly after lying down for more than 6 hours had a 34% higher risk of developing deep vein symptoms over 5 years. 34% just from how you choose to stand up each morning. Mistake 2. Stretching cold muscles. A lot of seniors have heard that stretching helps with leg pain and stiffness, so they sit on the edge of their bed and pull their toes toward their shins. They do this while their muscles are still ice cold from a full night of inactivity. This is one of the fastest ways to injure yourself without even leaving your bedroom. Stretching a cold muscle is like bending a frozen rubber band in half. You do not lengthen the muscle at all. You actually tear it on a microscopic level. Those tiny micro tears become scar tissue as they heal. That scar tissue creates chronic tightness that never goes away. That chronic tightness eventually becomes a limp or a walker dependency. Your nervous system senses those microscopic tears and says, "Danger, protect that area immediately." So your brain tightens the muscle even more to prevent further injury. You are literally training your legs to be stiffer every single morning. Stop stretching cold and start moving first. Mistake 3. Reaching for pain pills first. My legs hurt every morning, so I will take an ibuprofen before I even get up. I see this heartbreaking mistake every single day from well-meaning seniors. You are not treating the actual cause of your leg pain at all. You are just silencing the alarm that your body is desperately trying to sound. That morning pain is trying to tell you something important. Your circulation is sluggish from lying down all night. Your muscles are deconditioned from sitting too much. Your nerves are being compressed by tight hips and hamstrings. Masking that pain with medication is like taping a piece of cardboard over your car's check engine light. The problem does not go away at all. It just gets worse and worse until one day that light starts flashing. Long-term NSAID use after 60 is genuinely dangerous for multiple reasons. You have an increased risk of stomach bleeding that can send you to the hospital. You have an increased risk of kidney damage that will never reverse. You even have an increased risk of heart attack from daily ibuprofen use. One study found that seniors who took NSAIDs daily for just 1 year had a 42% higher risk of sudden cardiac events. You are not fixing your legs at all. You are borrowing mobility from your future self. So what should you do instead? You do this exact sequence every single morning. Part 2, the before you get up sequence, do this every morning. This entire sequence takes just 90 seconds from start to finish. You do it while lying down in your warm bed. Your feet never touch the floor until the very end. I will explain exactly why each movement works because understanding the why will make you actually do it. Step 1, the ankle pump. Stay lying on your back with your legs straight out in front of you. Do not sit up yet and do not bend your knees. Point your toes away from your body like you are pressing a gas pedal down to the floor. Then pull your toes back toward your shins as far as you can comfortably go. Repeat this motion slowly. Point and flex, point and flex, point and flex. Here is what is happening inside your legs during this simple movement. Every single time you flex your calf muscle, you squeeze your deep leg veins like a tube of toothpaste. That squeezing action pushes blood upward toward your heart and lungs. Your one-way valves snap shut behind that blood so it cannot flow backward. When you point your toes, the calf muscle relaxes and new blood flows in from your feet below. You are physically pumping stagnant blood out of your lower legs before gravity even becomes a factor in your morning. But here's the secret that most physical therapists will never tell their patients. The ankle pump also activates your soleus muscle, which is a deep calf muscle often called your second heart. The soleus is so effective at pumping blood back to your heart that some researchers believe it is the single most important muscle for circulation in your entire body. When you do not use your soleus muscle regularly, blood pools in your lower legs. That pooled blood causes morning pain, swelling, and that heavy feeling you hate. Do 20 slow and controlled ankle pumps every single morning. Feel that gentle pull in your calves. That is your second heart waking up to help you. Step 2. The glute squeeze. Keep lying on your back with your legs straight or slightly bent. Squeeze your butt cheeks together as hard as you possibly can. Hold that squeeze for 5 full seconds and then release completely. Repeat this squeeze and release 3 times in a row. Why is this simple squeeze so important for leg pain? Your glute muscles are the biggest and strongest muscles in your entire body. They are also the muscles that fall asleep most deeply overnight because you are lying on them for hours. When you stand up with sleepy and inactive glutes, your lower back and hamstrings have to take over the work of holding you upright. That is why so many seniors have lower back pain that is actually caused by weak butt muscles, not a bad back at all. Squeezing your glutes before you stand up wakes up that entire engine system. It stabilizes your pelvis so your legs can move correctly. It tells your nervous system that you are about to move and to get ready. Here is a simple test you can try right now. Stand up without squeezing your glutes first and notice how your lower back arches forward. That arch is a compensation pattern that creates pain. Now squeeze your glutes as hard as you can and try to stand up again. Your spine stays neutral and your weight shifts into your heels. Your legs do the work instead of your joints. That single difference is the difference between walking strong at 80 years old and needing a walker at 70. Step 3. The knee rock. Bend both of your knees and place your feet flat on the bed. Slowly rock both knees side to side together like a windshield wiper. Go left and then right, left and then right, left and then right. Keep the motion gentle and controlled without forcing anything. This simple rocking motion lubricates your knee joints in a way that nothing else can. Your joints contain something called synovial fluid, which is your body's natural oil for all of your moving parts. That synovial fluid thickens overnight when you are still and not moving. The rocking motion warms up that fluid and spreads it evenly around your entire knee joint. If you have knee arthritis or general knee pain, this single step alone will cut your morning pain in half within just 1 week of consistent practice. But here is what most people do not understand about knee pain at all. Your knee is not the real problem. Your knee is actually a hostage being held by your hips and your ankles. When your hips are tight or your ankles are stiff, your knee has to move in ways it was never designed to move. The knee rock loosens your hip joints and mobilizes your tibia bone. It takes pressure off your kneecap and gives you 3 benefits from one simple movement. Do it slowly and feel the gentle rotation. If you hear crackling sounds, that is just gas bubbles releasing. If you feel sharp pain, reduce your range of motion immediately. Step 4. The lying hamstring pull. Keep lying on your back for this next movement. Loop a towel, a belt, or a resistance band around the ball of your right foot. Straighten your right leg toward the ceiling as much as you comfortably can. Gently pull the towel toward your body until you feel a light stretch down the back of your thigh. Hold that gentle stretch for 15 seconds and then switch to your left leg for 15 seconds. Do not push into pain or bounce the stretch at any time. You are not trying to become a gymnast or touch your nose to your knee. You are simply reminding your hamstrings that they are actually allowed to be long and flexible. Most seniors have hamstrings that have been short and tight for decades. Here is why this hamstring pull matters more than any other stretch you do. Tight hamstrings are the #1 hidden cause of lower leg pain in people over 60 years old. Those tight hamstrings pull down on your pelvis constantly. Your pelvis tilts backward as a result of that pulling. That pelvic tilt compresses your lower spine and pinches the nerves that travel down your legs. Those pinched nerves send pain signals all the way down to your calves, your shins, and your feet. Let me give you a real example that will change how you think about leg pain. The sciatic nerve runs from your lower back down under your hamstring and all the way to your foot. When your hamstring is tight, it pinches that sciatic nerve like a kink in a garden hose. That pinch feels like burning in your calf muscle. It feels like numbness in your toes. It feels like a deep ache in your heel. Thousands of seniors are treating this as neuropathy with expensive medications and painful shots. The real solution is just loosening your hamstrings for 15 seconds every single morning. Step 5. The side lying clam. Roll gently onto your left side and stack your hips directly on top of each other. Bend both knees to about a 45-degree angle. Keep your feet touching each other the entire time. While keeping your feet together, lift your right knee toward the ceiling as high as you can. Open your legs like a clamshell opening up. Lower your knee back down slowly and with control. Do 10 repetitions on your left side and then roll over to do 10 repetitions on your right side. This movement activates your hip stabilizers, especially a muscle called the gluteus medius. When your gluteus medius muscle is weak, your hip drops downward every time you take a step. That dropped hip puts uneven pressure on your knee and your ankle with every single step. That uneven pressure becomes chronic pain over time. In fact, about 90% of all mystery leg pain in seniors comes from weak hip stabilizers, not from arthritis or aging at all. But you have to do this exercise correctly or it will not help you at all. Most people rush through their clamshells with no real effort. They swing their knee up using momentum instead of muscle strength. That does absolutely nothing for your weak glutes. You need to go slow and controlled on every single repetition. Pause at the top for 1 full second while squeezing your glute. Lower your knee back down over 3 full seconds. Feel that burning sensation in the side of your hip. That burn is your leg pain disappearing forever. Then and only then, you get out of bed. Swing your legs over the side of the bed slowly and carefully. Sit there for 5 full seconds and feel the difference in your legs. Notice how light and loose they feel compared to every other morning of your life. Stand up without holding onto the wall. No hobbling, no wall holding, and no 2-minute shuffle to the bathroom. Try this tomorrow morning and you will never go back to your old routine. Part 3. The Nighttime Routine for Leg Pain. What you do at night matters just as much as what you do in the morning. Here is your simple nighttime protocol for pain-free legs. Elevate your legs for 10 minutes before bed. Lie on your back and put 2 pillows under your calves. Let your feet hang off the edge of the pillows completely relaxed. This drains pooled fluid from your lower legs before you sleep for 8 hours. It takes pressure off your nerves and reduces the morning stiffness before it even starts. Stop eating 3 hours before you go to sleep. Why does this matter for leg pain? Digestion diverts blood flow away from your legs and toward your stomach. That is blood that could be circulating through your calves and feet all night. If you eat late at night, your legs go hungry for oxygen for 8 straight hours. You will wake up with numbness, tingling, and pain every single time. Sleep on your left side with a pillow between your knees. This keeps your spine in a neutral position all night long. It prevents your top leg from pulling your pelvis out of alignment. A neutral spine means no pinched nerves traveling all the way down to your feet. Try this tonight and feel the difference tomorrow morning. Here's what will happen when you start this routine tomorrow morning. You will stand up and walk without hobbling for the first time in months. Within 1 week, your night cramps will stop completely. Within 1 month, you will stop reaching for the railing on your stairs. Your legs carried you through 6 decades of life. They are not done yet. 90 seconds every morning changes everything. See you in the next video.